think one of the main things that sets our program apart is our true Division I team physician experience. We really try to elevate our fellows and put them in that front and center team physician role. They're not sitting in the backgrounds or up in the stands. They're not second or third in line. They are there, and we really try to put them in that role. So it's been a great experience for all the fellows that have come through. So we're really proud of the breadth of experiences that our fellows get to have here in our program. I think it's really important that when you go into a sports medicine program, you get to see not just a various types of sports, but various sports at various levels. And so when our fellows come through, they're gonna see everything from the Pee-wee football player to the elite dancer to the pre-professional soccer player. And so you really are gonna understand what makes that same injury different across those different sports. So our goal for you to come out of our program is not just to say, hey, I understand, the injuries, to say, I understand the athlete. You're gonna be an expert in the sports side of sports medicine, not just injury recognition and treatment.
I was looking for quite a lot of things. I was looking for a pediatric-based program because I'm pediatrics trained, but that also offered a wide breadth of adult care. I was also looking for a very good experience with the college level, and so being able to work with the University of Akron in a D1 program was really important to me. And then I was also looking for a place where I wasn't driving most of my fellowships. So it's really beneficial that here we're a mile from our university. I just came from there and it was a 5-minute drive. And so I was looking for somewhere where everything would be within a 20 to 30 minute radius, because I think it makes a really big difference for work-life balance. So the Akron Children's, the main campus, even this floor where orthopedics and sports medicine is held, is now sports health, and it's got completely revamped within the last couple of years. And it's really nice to work in the pods where we work. It's really nice to be right next to the athletic trainers. I'm gonna just have really close connection with the attendees, the patients, and the athletic trainers all in one space. And then the space that we work at over at the University of Akron is also brand new in the last couple of years. They built a clinic right on the university's campus, and it's literally, we joke, it's 100 yards from the training room because it's a field house, right? And so the training room's on one side, you walk down the football field, and then on the other side is they have a physical therapy center downstairs, and upstairs is where our clinic is. And so there's about 6 rooms. We have an ultrasound machine there that is state of the art. It's amazing to be able to do procedures on that. It's like looking into the cells. It's crazy how well you can see. We have a shockwave machine over there. That's where we do most of our procedures. We do some here, but we mostly do them over there. There's x-ray over there, and it's just a beautiful setup. It overlooks the field house, which is really nice too, to be able to have that connection. So if you're in the training room and you have a question and you want one of your attendings to take a look at something, you just walk 100 yards, you go upstairs, and they're right there, which is great to have that support too. But yeah, the facilities over there are incredible. I wish I could spend all day in that procedure room because we just get such great experience there. And I think they've hit it all right on the spot. I think that especially the D1 experience, I think has been above and beyond what I expected that it would be. Working with athletes that are at the elite and the intercollegiate levels and working with all of the sports has been really robust. I think that I've had great experience from a mentorship standpoint of the physicians that work with us, both here at main campus and at the university. But I've also been able to have graduated autonomy and been able to see my patients and take care of them and be the first provider for all of the athletes that I see, be it on the field or in the training room. Yeah, I think the biggest surprise or highlight, I think I have 2 of them. One, I just reiterate the D1 experience. I really, even being from the area, I really didn't realize that when this nationally ranked soccer player comes off the field, that the athletic trainer is taking him to me. I just didn't expect that feeling and that autonomy to be able to take that care and be that first person that's there. Same with being in the training room, being the only person that's there and that's able to triage and do so much with all of the sports, even if we don't do sideline coverage. I think the second one for me is I knew I would get great pediatric sports medicine experience, which in our world is high school to college, is technically pediatric. Is most of what we see. I didn't realize how much adult I would also be seeing, so I wasn't ready to see osteoarthritis or some of these more adult programs, and I've gotten a lot more comfortable with them. So I think coming out of this, I'll be a lot more well-rounded than I think I was expecting. We have such great continuity with our adult orthopedic surgeons in the adult world, and then we even see adults here at Akron Children's in the main campus. So that's been something that I feel like was a surprise to me and that I'm very grateful for with my background coming in with pediatrics.
I think the fellows that do best in our program are the ones that are very proactive and come with a sense of trying to take responsibility for their own fellowship. We really pride ourselves on being flexible, being open to fellows crafting and customizing their own fellowship experience, because we recruit from multiple different backgrounds and our fellows go on to multiple different practice settings. So we want our fellows to come to me and say, hey, I think I could use a little bit more in this area. And we're saying, great, go do it. Our fellows look to us not at, for permission, but to help facilitate it. And so we tend to meet those questions with an enthusiastic yes. Our goal is that every fellow has a slightly different experiences and they make it what they want to get out of fellowship. I think one of the things that helped me choose this program and why I've stuck around for so long is that everybody here embraces the culture of teaching. I have physical therapists reaching out to me asking to do lectures rather than the reverse. We have our orthopedic surgeons involved. We have all of our sports medicine physicians. And so everybody takes an active role in the fellowship and takes ownership of it. There are some programs you'll see where it's almost like the fellowship is a side project and it's not really integrated into the department. Our fellowship program is integrated into our department. It is front and center, and everybody takes ownership of that and really embraces the fellows from day one.
I think just overall, as far as the program goes, I think it's one of those programs that really hits all of the boxes. So I think that, you get great D1 college experience, you get your own high school, which is within a short radius. Everything is within, 20 minutes, which is super nice from a work-life balance standpoint. But then you get great mentorship. Like, I can't complain about a single attending that I've worked with, and that's between sports medicine, peds orthopedics, adult orthopedics. Everyone is just more than willing to give you their knowledge. And with having only a year to learn all of this, you need people that are willing to teach you and to really break it down to the level that you're at. They do a great job of meeting you where you are. So we've had fellows from pediatrics, internal medicine, PM&R, emergency medicines, family. So everyone comes from a little bit different of a background, and they meet you where you're at and they take you all the way until attendinghood. You really can't ask for anything more than that.
Another thing that we have in our program that's fairly unique is we actually host an in-house cadaver lab to do ultrasound and procedure training. So a lot of times fellows are going to conferences and they'll sign up for, a musculoskeletal ultrasound course, and it'll be you and 4 or 5, trainees sharing a probe, sharing an instructor, and you spend most of your time waiting in line. And we actually, every year, will set up at the beginning of the year an in-house cadaver lab where myself and Dr. Eddie and a couple of the other providers will bring down 2 probes, 2 specimens for 2 fellows. So it is direct one-to-one experience. You will spend the entire day, and believe me, you will get a ton of injection experience. So I love living in Akron. I think you'll see that actually a lot of our providers are local, homegrown, and stick around. We've drunk the Northeast Ohio Kool-Aid, so to speak, but there's a lot to offer here. Some of the things that I personally like about living in Akron and living in Northeast Ohio is that we are plopped front and center in the middle of the Cuyahoga Valley National Park. So we've got a lot of outdoor activities. I do mountain biking and road cycling and running. You can kayak down the river. You can do some trails with your kids. We do the fall hiking spree every year. So it's really a beautiful area to live if you're into that kind of stuff. You kind of get a little bit of everything here. You're close enough to the cities, you're close enough to the suburbs, and you're close enough to nature. So it's kind of a choose your own adventure here in Akron.
If a fellow was considering Akron Children's, what would I say? I mean, I would say go for it, obviously. I'm very biased, but I would say rank them as high as you can. I think that Akron in and of itself is a gem, right? It's a hidden gem. It's a city that not a lot of people, we know about it because of LeBron, but not a lot of people know about the city itself, the university that we work with so closely, the local high schools that we get to work with. And so I think if you are considering Akron Children's, it will pay off for you if you rank them high and then you end up matching here. I think the 2 fellows every year are some of the luckiest sports medicine physicians that will be in the field.